Navigating supplement intake during cancer treatment can be complex. Knowing what to include and what to avoid is crucial for supporting your health and enhancing treatment outcomes. As part of the Patient Empowerment Network Restore program, we're exploring the best practices for supplement use during treatment. Julie, what are the key do's and don'ts when it comes to taking supplements during cancer treatment, and how can patients ensure that they're choosing the right supplements without interfering with their treatment?
Yeah, well, I guess the number one do is to make sure your medical team knows what you're taking. And the number one don't would be don't hide what you're taking from your medical team. Maybe the number two do is follow their advice. There's a lot of us in oncology care are very cautious about supplements. And the reason we're cautious is kind of twofold. One, there's not a lot of great data suggesting that taking nutrients in pill form is beneficial. I know there's a lot of advertising by the supplement companies. It's a very profitable business in the US. So they have a lot to gain by advertising. However, when it comes to the science and evidence behind the supplements, it's pretty weak. So I always tell people, you know what? There is a use for nutritional supplements, but it should be as a result of some kind of clinical test that you have that suggests that you have a deficiency. When you have a nutrient deficiency, that's when you need to take a supplement and you take it for a period of time and monitor that clinical outcome to see, is it helping? And, do I need to stay on it or not? The things that I don't want people to do are to just take supplements because someone told them it would be good for them, and they just take it and they don't even really know what they're taking. Those are, to me, the situations where we're like, let's not do that. The supplement industry is not regulated in the same way that food and pharmaceuticals are. So they're sort of, free range industry. They don't have to show the same kind of data that pharmaceuticals do. They don't go through the same quality standards that food does. So my biggest concern is actually that a supplement would be contaminated with something harmful, which we have seen happen many times. But you won't know necessarily that what they say is on the bottle is what's actually in it. So what I want to do with people is to make sure that they're only taking, nobody wants to take extra pills. I mean, especially people who are already taking lots of medication, they don't want to take extra pills. So let's not take extra pills if we don't have to. So a lot of times we'll actually, take people off any regular supplements that they're taking if we don't think that they're necessary or if we think they might be harmful.
Okay.
So really paring it down can be helpful. And then always showing the bottle to your treatment team so they can look and just see if there's anything questionable in it that you want to be concerned about.
All right, thank you. Are there any specific supplements that should definitely be avoided or carefully monitored? We hear a lot of cancer patients, and I hear a lot of suggestions, take turmeric or TUDCA or those things. Are there any that you would say not to take in general?
Yeah, I mean, antioxidant supplements are generally things we don't want people to take. And then things like St. John's wort can commonly interact with a lot of different oncology medications. So those are kind of two major ones that we often tell people not to take. I don't think that it's necessary to take anything more than just a regular multivitamin if you want to be taking something. And most treatment centers will kind of have that as their policy, that during treatment, they don't want you to take anything except a multivitamin. And then after active treatment is over, then you can have a discussion about what might be safe to sort of restart if you feel like you really need them. So those are the ones that we would want to be cautious with. But then again, if somebody is deficient, so if you're low in iron or low in vitamin D, you do need to take a nutritional supplement. Sometimes you can get pharmaceutical versions of those, which I think is nice because then it guarantees a safety standard. But sometimes then the price is off the roof. So definitely in partnership with your medical team is what you really need for those supplement and sort of herbal strategies.
You heard it here straight from our expert. Thanks for joining us on the Restore program. I'm your host, Lisa Hatfield.